Hey everybody, Dr. Rob Silverman here. A lot of people have been asking me about it in my office, a lot of my colleagues. Everybody wants to know about what a food sensitivity is and why do I use it as a baseline test with the bulk of my patients. Now, what's most interesting about food sensitivities is that a lot of patients get confused with the idea of a food allergy. So let's differentiate between the two. A food allergy is very simply an IgE mediated reaction. And what I mean by that is it's a very fast acting immune reaction. You'll know if you have a food allergy. You'll swell, you'll get red. Some people actually have itching behind their ears. It's a quick reaction after you consume the food within approximately an hour. Let's use that as a vantage point. Whereas a food sensitivity is very unique. It's a very different immunological reaction. It's what we call an IgG reaction. Now, the key to a food sensitivity, and this is why it's so critical to take a test and why you really can't do a food diary to ascertain what it is. It can take anywhere from 4 hours, but most commonly up to 3 days, 72 hours to get a reaction. So how can the doctor or how can the patient really ascertain a particular food 3 days earlier gave you these food sensitivities? Now, when you think about it, you eat groups of foods, all different kinds of foods. When I talk about groups of foods, you may have a fish, but you may eat multiple fishes and get truly confused. So once again, for me, a food sensitivity test is a critical element in isolating and ascertaining if you have a food sensitivity. Now, if you do, what is the issue? What kind of problem does it pose? Well, number one, with a food sensitivity, it shows me two specific things. Number one, it shows that you have a leaky gut or an increased intestinal permeability and a digestion issue. So food sensitivity, or to isolate and be able to test for it, is quite evocative in the idea that it really shows me life applicable things of, once again, leaky gut and digestion issues. So the food sensitivity is interesting in that if I tell you the more common ones, everybody will know them. Obviously, gluten, dairy, corn, lectins. About 100 million people worldwide have food sensitivities. Probably, again, the most common one is gluten. So obviously, we want to avoid gluten. Now, in addition to the food sensitivities, what I've found is there are a lot of emulsifiers, additives, and chemical toxins that can lead you down a path and generate a food sensitivity. Now, what do I mean by that? An emulsifier, an additive like a polysorbate 80, these red and yellow colorings, specific emulsifiers in food, glyphosate. Now, glyphosate, as we all spoken about, is in Roundup, and it's in our soil, and glyphosate is without question deleterious to gut health. As a matter of fact, there's been a parallel increase between the documented rise of celiac disease and the use of glyphosate. So glyphosate actually holds down the protein in on the gut, and that protein is, I was just looking at my thing here. Hey, Lila, great information. Thanks a lot. I really appreciate that. The glyphosate holds down the gliadin protein and leads you down a path of like anchoring it to the gut, causing leaky gut. So this is a very basic premise. The tests that I use in my office are very simple. I use a blood stick or a blood spot. I test for about 176 different foods, and I also test for about 10 different additives. Now, if you really wanted to double down on the idea of a food sensitivity, a great marker to test for in addition to food sensitivity would be a food structural protein called zonulin. Zonulin is the key protein that holds our gut or our tight junctions together. When zonulin is expressed, it implies that we have no longer a tight junction, we now have a loose junction. And if you have that loose junction, you've got to go through a whole processes of trying to fix the gut and allowing the gut to heal. I use what I call a 7R program. But to backtrack a little bit to get back into the food sensitivities, what are some of the things that I recommend? Well, once you test for the food sensitivity, and the food test that I use the FIT test, which is a food inflammation test, 176. There's ratings. It's color coordinated so the patient can really see it. There's a 4, 3, and a 2. So it is severe, moderate, and mild going down if for me, any kind of sensitivity is shown to a particular food, I remove the food. I go through my process of fixing the gut, usually from 1 to 3 months, and then I reintroduce the food. Now, many times before I even reintroduce the food, I will retest. The beauty of a food allergy is that, or I should say the unfortunality of a food allergy is you're probably always going to be allergic to the food. Whereas a food sensitivity, once you remove it and fix the gut and fix the surrounding areas in the gut, you're probably going to be able to eat the food again. So it's not a death sentence to the food. It's just a duration of time. My suggestion for everybody, try and get food sensitivities testing done, get a great baseline. You'll be real surprised at how many different foods you're sensitive to, but you'll be extremely happy after you follow a 3-month program and then reintroduce the foods. Guys, have any questions? Feel free to reach out. I'm always here for you. My name is Dr. Rob Silverman, always yours in health.